Hi, my name is Abby James, and in this video I'm going to be demonstrating how to position patients for radiographic studies. So we're going to start with all of our VDs and dorsoventrals on our little kitty cat here, and we're going to do his exposure towards the end. So for starts, we're going to start with the ventrodorsal view of the skull. We will just go ahead, and he is sedated prior to doing it. Okay, so hold his little hand like that. You'll just slide him down a little bit. Okay, so that would be our dorso-ventral view of the, say that correctly, ventrodorsal view of the skull. So next we're going to go ahead and do the ventrodorsal view of the cervical spine. So we're going to go ahead and turn him this way. Our monitor is kind of tangled up in the midst of it. Yeah, we'll put it that way. Position him there. And we want to make sure we get the base of the skull in the image and down to the chest. So widen that just a tad bit. Okay, and now we'll have a dorsoventral view of the thorax. We're going to do dorsoventral. Okay, so now I'm just going to go ahead and collimate that. And that would be our dorsoventral of the thorax. He's facing down with his back up. Okay, so now we have a ventral dorsal view of the thorax. So we'll turn him the other way. Okay, so again, you'll hold those little feet up. Okay, so again, he's on his back. I'm going to collimate this a little bit to get less of his abdomen. And that is where we would take our exposure. Okay, and we're going to do a VD of the abdomen. And that is where we would take our exposure there. Okay. And we're going to go ahead and measure him and make sure we collimate the machine. This is going to be our exposure. He is going to have an x-ray done on his leg here. So we're right at the 2. Okay, so now we have a little chart back here. So I got the measurement of 2 centimeters. So I'm going to go ahead into the extremity side, and that's going to tell us our KVP and our time. So that's going to be set to 67. Oh, I'm sorry, 47. Okay, and that's going to be set to 47. Alrighty, and now we are ready to go ahead and get our exposure or our x-ray done. I do have my x-ray markers here, so we're going to lay those down. Okay, so this is the second portion of that video. We're going to be doing all of the lateral views. Hi, baby. We're going to be doing all the lateral views on our canine here, and at the end we're going to go ahead and do the exposure. We're going to try to do the exposure on her abdomen on the last view for her. Okay, so we're going to do a lateral of the skull. I know, you're going to do so good. He said, actually not. Hey, it's okay. It's okay. It's okay. Great. Hey, and we'll just pull her down. Okay, so this is kind of how we would do a lateral view of the skull. Ideally, they would be sedated, and she would have her little, and her head would be laying flat down, kind of sort of like that. So we're just going to move on. Let's see, so we're going to do a flex lateral view of the cervical vertebrae. Okay, what are we doing? Flex lateral view of the cervical vertebrae. Oh my goodness. Oh my goodness. So go ahead and shorten that. So if you'll just flex her neck all the way up if you can. Perfect. So we have the view of the flex lateral on her cervical vertebra. So I believe we're going to have one on the lateral view of the thorax. So we're just going to move her down for that. Okay, so that would be our lateral view of the thorax. And then we're going to use the last one, which is the abdominal view for our last one and our exposure. So I'm just going to let her up really quick. And then we'll go ahead and measure her for that. Okay, so we're right about 10 centimeters. So again, I'm just going to go ahead and go to our chart back here. And that will just show us the thorax, abdomen, pelvis, skull. So we'll go down to the 10, and it's saying for the abdomen she should be set for 60 for the KVP. Okay, so I'm gonna go ahead and put our markers down.
I know, you're doing so good.
Bring her back.
I know. One more time. One more time.
I'm going to collimate that a little bit better just to her abdomen. All right. Okay, so now we've gotten both views. We will go ahead. We'll go ahead and show both images at the end of the video.